Hi, my name is Danielle Voorhees. I'm the Health and Human Sciences educator for Purdue Extension in Grant County. And today, in this video, we're going to be talking about tips for preventing dementia. So what will be covered in today's video is what is dementia, the prevalence, risk factors, tips for preventing dementia, home safety, dementia-friendly communities, and resources. So what is dementia? The word dementia describes a set of symptoms that may include memory loss and difficulties with thinking, problem solving, or language. Dementia is caused by a number of diseases that affect the brain. The most common is Alzheimer's, but diseases also include vascular dementia, dementia with Lewy bodies, and Pick's disease. I will link the YouTube video and the slide in the description so you can view it on your own time. Next, we will be talking about the prevalence. How common is dementia? Worldwide, around 50 million people have dementia. Nearly 60% of those people are living in low and middle income countries. Every year, there are nearly 10 million new cases. The estimated proportion of the general population aged 60 and over with dementia at a given time is between 5 and 8%. The total number of people with dementia is projected to reach 82 million in the year 2030 and 152 million in the year 2050. Much of this increase is attributable to the rising number of people with dementia living in low and middle income countries. A risk factor is anything that increases a person's risk of developing a condition. So first, we'll talk about risk factors that we can't control. Age. 6 out of 100 people aged 75 to 79 will have dementia. Genetics. Most instances of dementia are not inherited, but we can inherit genes from our parents that make us more vulnerable. No copies. 6 out of 100 75-year-olds will have dementia. 1 copy. 11 out of 100 75-year-olds will have dementia. 2 copies, which is very rare, results 18 out of 100 75-year-olds will have dementia. So now let's talk about risk factors that we can control. Our lifestyle choices. Non-smokers. 6 out of 100 non-smoking 75-year-olds will have dementia. Smokers. 9 out of 100 smoking 75-year-olds will have dementia. Ex-smokers. 6 out of 100 ex-smokers 75 years of age will have dementia. Diabetes. 6 out of 100 75-year-olds without diabetes will have dementia. 10 out of 100 75-year-olds with diabetes will have. Additional risk factors we can control include exercise, diet, alcohol consumption, social life, and sleep. We are going to discuss these further in the prevention section of this presentation. Tips for preventing dementia. Break a sweat. Of all the lifestyle changes that have been studied, taking regular physical exercise appears to be one of the best things you can do to reduce your risk of getting dementia. Combining the results of 11 studies shows that regular exercise can significantly reduce the risk of developing dementia by about 30%. For Alzheimer's disease, the risk was reduced by 45%. In general, they are referring to aerobic exercises performed for a sustained period of time, so about 20 to 30 minutes. Most of the studies report on the effects of aerobic exercise done several times a week and maintained for at least 1 year. Hit the books. Formal education in any stage of life will help reduce your risk of cognitive decline and dementia. Butt out. Smoking increases risk of cognitive decline. Follow your heart. Risk factors for cardiovascular disease and stroke, obesity, high blood pressure, and diabetes negatively impact your cognitive health. Heads up. Brain injury can raise your risk of cognitive decline and dementia. Wear a seatbelt, use a helmet when playing contact sports or riding a bike, and take steps to prevent falls. Fuel up. Mediterranean-style diet. There's some evidence that eating a Mediterranean-style diet can reduce the risk of developing problems with memory and thinking and getting some forms of dementia. This diet includes high in fruits, veggies, moderate oily fish and dairy, low in meat, sugar, and saturated fats. Catch some Z's. Not getting enough sleep due to conditions like insomnia or sleep apnea may result in problems with memory and thinking. Take care of your mental health. Some studies link a history of depression with increased cognitive decline. Seek medical treatment if you have symptoms of depression, anxiety, or other mental concerns. Buddy up. Staying socially engaged may support brain health. Pursue social activities that are meaningful to you. Find ways to be part of your local community. Stump yourself. Brain training. Some studies have found that cognitive training can improve some aspects of memory and thinking, particularly for people who are middle-aged or older. Challenge and activate your mind. Includes, but not limited to, crosswords, Sudoku puzzles, jigsaw puzzle, building something, and playing games. So far, no studies have shown that brain training prevents dementia. However, this is a relatively new area of research, and most studies have been too small and too short to test any effect of brain training on the development of cognitive decline or dementia. Evidence suggests that brain training may help older people to manage their daily tasks better, but long-term studies are needed to understand what effect, if any, these activities may have on a person's likelihood of developing dementia. Home safety. Alzheimer's disease causes a number of changes in the brain and body that may affect safety. Depending on the stage of the disease, these can include judgment, forgetting how to use household appliances, sense of time and place, getting lost on one's own street, behavior, becoming easily confused, suspicious, or fearful, physical ability, having trouble with balance, and senses, experiencing changes in vision, hearing, sensitivity to temperatures, or depth perception. Dementia-friendly communities. England and Wales, according to a website. The process asks communities to commit to delivering change and is structured around two key documents: the BSI Code of Practice for Dementia-Friendly Communities, the Foundation Criteria for Dementia-Friendly Communities. Focuses on improving inclusion and quality of life for people with dementia in a number of ways. Resources. Nationally accredited, award-winning nonprofit that offers a variety of programs and services to help people at risk of losing their independence, their families, and their communities in East Central Indiana. Life Stream services touch the lives of 19,933 older adults and people with disabilities by helping them remain independent through programs and services including transportation, in-home care management, home-delivered meals, senior cafes, caregiver support, guardianship, information and referrals, and much more. QSource Indiana. Our focus in Indiana is serving the state's approximately 1.15 million citizens with Medicare as the Quality Innovation Network Quality Improvement Organization. The CICOA Aging and In-Home Solutions started in 1974. It's a nonprofit agency that helps seniors and people of any age with a disability remain comfortably and safely at home and out of institutional care. And SHIP. The SHIP mission is to empower, educate, and assist Medicare-eligible individuals, their families, and caregivers through objective outreach, counseling, and training to make informed health insurance decisions that optimize access to care and benefits.